There are several ways in which a patient can be referred to Indiana University Health Home Care for services. To ensure that patients receive the services and products the physician has ordered, our goal is to make the referral process as simple and efficient as possible. Who can make a referral or inquiry about home care? Anyone can make a referral or inquire about or request home care services. Usually someone such as a nurse or receptionist from a physician's office, or a nurse or case manager from the hospital or a clinic will call the home care provider to communicate referral information, or may send the information electronically. But it's important to note, only a physician can officially sign orders that authorize the home care provider to provide care and treatment for patients. What information does the home care provider need? The provider will need some basic demographic information about the patient, such as name, date of birth, address, telephone number, insurance information, and patient's diagnosis or list of current health conditions, and medication list, as well as information about what the physician thinks the patient will need. For example, skilled nursing, pediatrics, one of very few providers in the state, physical, occupational, and/or speech therapy, social work, infusion medications, IV nutrition, or tube feedings. Some insurance plans dictate that prior authorization for services is required, and Medicare now requires documentation of a face-to-face encounter with the physician in order to cover home care services. The referral intake team is very familiar with insurance requirements and can work with the referral source on a case-by-case basis to ensure coverage criteria are met. When will the home care visit take place? Home care regulations require that the patient be seen by the home care provider within 48 hours of the referral or discharge from the hospital, unless the referral information specifies a different start date. The home care provider will contact the patient or family within that 48-hour window of time to schedule the visit and to let the patient and family know what to expect so that the initial visit is as productive and efficient as possible. What is the referral process? Hospital staff or the physician's office staff should first discuss with the patient whether he or she would like to utilize a specific home care provider, because IU Health always respects patient choice. Patients usually don't have much experience with home care, so they often seek advice from the physician or the hospital case manager. Because they have already put their trust in an IU Health facility and/or an IU Health physician, patients often prefer to continue services within the system when possible. Please refer to our brochure for current information about IU Health Home Care's coverage area and office locations if your patient wishes to use IU Health for home care services. Once the patient's choice has been determined, the referral information can simply be sent electronically, via telephone or faxed to a centralized referral management team. In some locations, referral information may also be phoned in or faxed directly to the local IU Health Home Care office. Please see our current brochure or contact one of our offices for specifics. You can expect a quick response from the intake team verifying that the referral information was received. They may request additional information pertinent to arranging services, based on regulations or insurance requirements for home care orders, to make sure that the patient receives exactly what the physician intended. A representative from the intake team will contact the referral source to confirm arrangements once insurance coverage is checked and clinical services are scheduled. Occasionally, even though a patient has selected an IU Health facility or physician for care, IU Health Home Care will not be able to provide services. For example, when IU Health Home Care is not the patient's insurance provider network, the patient requires a service that IU Health Home Care does not offer. IU Health Home Care is not able to provide services within the required time frame, or the patient lives outside the IU Health service area. In those situations, the referral source will be alerted as quickly as possible, and other options presented to ensure that the patient receives the necessary care in a timely manner. The team at Indiana University Health Home Care know that when you make a referral for home care, you want assurance that the agency will provide the very highest quality care and service. Our goal at IU Health Home Care is to always use our special expertise to deliver the best outcome for patients and families. We appreciate the confidence and trust you've shown by allowing us the opportunity to partner with you in the care of your patients. We strive for continuous improvement because we know that our patients' perception of home care services can color their perception of the entire IU Health organization. And so we welcome and encourage your comments, questions, and suggestions. Thank you for considering Indiana University Health Home Care.